Hi, I'm Dr. Jeffrey Brown. Today I'm going to talk to you about one of the best, if not the best, non-invasive treatment for back pain. Now, if you Google non-invasive treatment for back pain, you will find muscle relaxers, anti-inflammatories, and other medications. But you may want something more natural with no side effects. So then you search again and you'll find heat and ice pads applications, you'll find massage, stretching, maybe even some exercise. These feel great, but if you still have the pain, then what are your options? Now, I consider acupuncture and injection therapy as invasive. So I'm not including those in this best non-invasive discussion. Anything that may cause someone to sweat or get nervous probably isn't non-invasive. So, high power laser therapy is what I'm going to talk to you about today. Now, laser is an acronym for light amplification by stimulated emission of radiation. Low-level laser therapy has been around for well over 40 years in Europe and has been getting more popular here in the United States for the past 20 to 25 years or so. There are different types of laser in medicine. The therapeutic laser is what I'm going to talk about today. It is used to stimulate cellular function. Now, a class 3B laser, which is a low-level laser, or cold laser, which most of you may have heard about, has between 6 to 500 milliwatts of power. A class 4 laser has over 500 milliwatts of power. And the class 4 laser that we like to use has over 7,500 milliwatts of continuous wave power. So why is power and the amount of energy important? 65% of laser energy is absorbed in your skin and subcutaneous tissue layers. The hemoglobin in the blood, melanin in the skin, hair, moles, etc., and water, they all have a high affinity for absorption of laser energy. So in order to overcome those factors, you must start with large quantities of energy. The higher the wavelength, the deeper the penetration of photon energy. So how does it work? Laser therapy aims to biostimulate the injured and dysfunctional tissue. So hang in there now with me. This is going to be a quick science lesson for those who didn't like biology class, right? So, chromophores are components of molecules which absorb light. The stimulation of these chromophores on the mitochondrial membranes initiates the production of ATP. Now remember, the mitochondria is the engine or powerhouse of the cell, if you recall that from biology. And ATP is the energy source the body uses. Now, the production of ATP leads to the following biological cascade of events. You will see increased growth factor response within the cells and tissues, accelerated cell reproduction and faster repair of the damaged tissue, increased metabolic activity, which gives you more oxygen and nutrient availability, improved vascular activity, which means more blood flow to carry everything to the injured tissue. You're going to see anti-inflammatory and analgesic effects by increasing your endorphins. All right? There have been thousands of published studies and hundreds of double-blind studies done on laser therapy. It is also FDA cleared for human application. Not only is it great for back issues concerning disc problems, spinal stenosis, or failed surgeries, but it's great for arthritis, any musculoskeletal problem, shoulders, elbows, feet, wrists, etc. It also works on neuropathy, ulcerations, and open wounds. So if you're looking for a non-surgical or non-invasive treatment option that has been proven very effective and has no side effects, then you should seriously consider high-power laser therapy. Thank you for listening to All That Science. I look forward to speaking with you again in our next video, and I wish you a health and happiness. Thank you.